class. Today I am presenting a video for an overview on Unit 4 covering phlebotomy and blood glucose measurement. So let's jump in. Here are your learning objectives for today. Remember, you need to review the associated chapters as well as watch this video and all of the associated skills that we will be covering as well. So phlebotomy, also known as venipuncture, you will hear me use those words interchangeably, so make sure you understand that those are the same thing. This is a technique used to acquire blood for testing, right? So a phlebotomist is a person that's specifically trained for obtaining blood specimens. How we are involved in phlebotomy varies from facility to facility. Sometimes you will have a phlebotomist present, so you may or may not be also performing venipuncture. In some places you may be the only one performing venipuncture. It just depends on the site. So moving on to the circulatory system, it's important to understand how blood flows through our body in relation to how we obtain blood. So we obtain blood from veins and not arteries. Remember, arteries are what we were palpating for a pulse. I'm so sorry about that, guys. We only use veins. So moving on to the differences between arteries and veins. Arteries are what carry blood from the heart. So this is our oxygenated blood. It's normally bright red. They have elastic walls that expand, right? Because they pulsate. They don't have any valves, and you can always feel a pulse with an artery. Now with veins, they are carrying blood from our extremities back to our heart, and they are deoxygenated. This blood is normally dark red in color. They have thin walls, and they are a little bit less elastic. They also have valves, and the reason that they have valves is because it's not allowing for backflow. We need this blood to be pushed up from the bottom back up to our heart. So these valves help to make sure there is no backflow in that plumbing of our circulatory system. And veins will never have a pulse. So if you are performing venipuncture and you feel a pulse, do not stick, right? Because that will be an artery and not a vein. So plasma, serum, and whole blood. We have about 6 liters of blood in our body. We've already talked about those formed units in previous lectures. We also have 55% of our blood is known as plasma. I'm trying to see what else. Pretty much just understanding what blood is made out of. Here, most of our lab samples are performed on serum, plasma, or the whole blood, so one of those 3 items. The formed elements in the liquid, serum or plasma, are usually separated for testing. So you can see our test tubes here where they've separated the plasma from the whole blood as well for testing purposes. They may just be testing the serum, they may just be testing the blood itself there. So let's talk venipuncture sites. The preferred site for venipuncture is the antecubital space, or you may also hear it be called the antecubital fossa or the AC. This is the area directly in the crease of your arm. So right between the upper arm and the forearm on the opposite side of your elbow. This is where the veins are more near to the surface and they're larger enough to give access to blood. The median cubital vein is used the majority of the time. You see it right there, the median cubital vein. If you look at your own arms, you may be able to see this or feel this vein here. If you're not able to palpate the median cubital vein, you may also be able to feel the basilic vein or the cephalic vein. As you see, it goes all the way up the arm here, the cephalic vein, or the median vein. So the median vein travels below the median cubital down our forearm. When necessary, we can also look at the top of the hand or on the inside of the wrist. So we will start at the antecubital fossa, move to the top of the hand, and then on the inside of the wrist. Lastly, we would choose to go towards the feet. And the feet, you have to be trained specifically on how to perform venipuncture because you can mess with some different veins and things like that in the foot. You may hit a tendon, not on purpose, of course, but it's just better to start in this area and move down, and only be specifically trained to venipuncture in the feet. So our equipment for venipuncture, we need a syringe. You can see a picture of a syringe here. A needle. There are various types of needles we'll get to in a second. A vacuum tube. That is that colored tube that actually holds the blood. An anticoagulant, additive, or gel. These are usually inside of the vacuum tube. You may or may not have known that. A tourniquet to allow for those veins to become more prominent. And then specimen collection trays, which a lot of phlebotomists use just to keep everything organized. May include their Band-Aids, different gauze or 2x2s, tapes, things like that. So as far as our needles go, I said we have lots of different ones we may use. We refer to needles in the size of their gauge, so a gauge size. And the way that they're called are by numbers. So a 16 gauge is actually the biggest needle. So a 16 gauge is the largest, commonly used in blood donations. And as the numbers get bigger, the needle actually gets smaller. So think opposite in this case. So 18 gauge, not usually used for phlebotomy, but sometimes used for blood banking. A 20 gauge, appropriate, but is a little large for common phlebotomy. In our ER, we often put 20 gauge IVs in people because we do want a little bit larger of an access. 21, most common size with a vacuum tube. A 22 gauge, preferred for pediatrics, and a 23 gauge is sometimes used with a butterfly system. So there are different methods for obtaining blood specimens. We have our vacuum tube system, a butterfly system, and a syringe system. And I believe if it's not in this PowerPoint, I will post different videos on these different methods. But read over this slide. It tells you how different they are, when they're more indicated for use, the advantages of these different methods, and the disadvantages as well. So here I'm going to go over the blood collection tubes. We're going to talk about color, but I don't need you to know all of the details. What I want you to know for these vacuum tubes is really the order that we draw them in. It is important that we draw these vacuum tubes, meaning we collect them in a certain order based on their color. We'll get to that just in a second. But over the next few slides, you'll see that we have these different colored tops. It tells you what type of additive or things that are inside the tubes and what they're used for. I don't need you to memorize all of that. Will have a reference when you're working. You will also become very knowledgeable of which tubes do what and what color you need to grab for which tests. But for now, I really want you to just focus on the order in which we draw them. So here again, just moving through those blood tubes, those vacuum tubes, and what they include and what their uses are. Here is what I really need you guys to focus on, the order of the draw. So it is important that we draw these labs in a specific order based on the color of the vacuum tube and what they're being used for. So the very first thing we always grab, if we are grabbing these from a patient, is a blood culture. A blood culture tells us if there's any bacteria in the bloodstream. So we do this first before it can become contaminated. So we start with a blood culture. These are what these blood culture bottles look like down here. They sometimes look a little bit more like an airplane bottle. If you can think of like a liquor little airplane bottle, has a longer neck. They sometimes look like that. Then moving down, you would then grab a light blue top. The light blue top. Then red. Then green. Then lavender. Then gray, and then a dark blue top. Now you'll see that there are some other colors that are not mentioned here. These are our most popular colors, and that's why I've only included these. If you have additional tests, you may actually refer to the lab as far as which one you would grab first. So you may be thinking, how in the world am I going to remember what order to draw these labs in? Well, I have a helpful mnemonic, and I'm grabbing it out here. A helpful mnemonic to help you remember how to do the order of this draw. So if you guys want to write this down, it will be helpful. So the mnemonic is beautiful, which stands for blood cultures, lilacs, light blue, roses, red, geraniums, green, lilies, lavender, grow, gray, daily, dark blue. So that mnemonic, beautiful, lilacs, roses, geraniums, lilies, grow, daily. So that mnemonic is just something that I came across that is supposed to help you in remembering the order of the draw. So some principles for venipuncture, and these are also addressed in the videos that I've created for our skills, but I just want to kind of reiterate some of the points here. So the number one, the very, very first step we always do for venipuncture is put the patient at ease. They're often going to be anxious, they're going to be scared, they're not going to want to get their blood drawn, so the first thing we always do is put the patient at ease. Have our supplies ready, identify our patient, know what tests we're going to be including, position the patient appropriately, which means making them comfortable and having their arm at an appropriate level, selecting an appropriate vein. You see in this picture they are using that antecubital area, and then applying the tourniquet, which I've already created a whole video going over that. One thing I do want to note is that tourniquet should not be on any longer than 1 minute. If we keep it on longer than that, it will begin to affect our sample. So performing a safe and successful venipuncture, we first want to find that site that will give us the best blood return. We're going to be relying on touch, so we're going to be practicing on closing our eyes and palpating. So feeling that area that will have the best vein for us. Tracing the vein, feeling if it turns, if it has any knots, anything unusual. If we don't find anything in one arm, that's okay. The patient has 2 arms, so try that other arm, see if it has a better vein. If that vein has a pulse, remember, do not use it. Also, tendons can sometimes be deceptive, so remember, veins will be bouncy, tendons will be more hard in nature. We want to stimulate the vein. This means positioning the patient's arm lower than their heart. Don't have them holding it up. It needs to be down. Gravity is our friend. Massaging the arm from wrist to elbow encourages that venous return. We can also tap sharply on the vein with our fingertips or warm the area with a warm washcloth. You may see different providers asking the patient to pump their fist. This is actually not a best practice. They should make a fist, however, they should not pump the fist. And then if you attempt your venipuncture twice and are unsuccessful, you need to stop. After 2 attempts, always try and find someone else, someone maybe that has more experience than you that can attempt to do venipuncture. We don't want to keep putting our patient through pain and torture just because we're unsuccessful with the venipuncture. So for each of those techniques, they are here in our PowerPoint, as I mentioned. The syringe technique, so you can watch this video understanding how venipuncture is completed through the syringe technique. The vacuum tube specimen collection, you'll see here a little bit different. So the vacuum tube is directly into this needle vacuum tainer system here. What we will be practicing with is a butterfly needle system. And these are great for really small veins, fragile ones, think our elderly patients, even children. And this butterfly needle system is great to use. So this is what we'll actually be using in class. So patients often react kind of poorly to blood draws. They may have been anxious. They may have been fearful. Sometimes they even become nauseous, or they may even experience a syncope or a fainting episode. So just be aware of that. Remember to try and talk to your patients. Check on them after you complete the blood draw to make sure they're not experiencing any of these things. So factors that can affect our lab results. I want you guys to read over this table and understand what things can affect it, and think through when you're drawing these blood tests, was there anything that occurred that could have affected my laboratory results? Now I'm going to stop the video here, and I'm going to pick it back up in a different video. So thank you guys for watching. Be sure to watch this second video as we continue on with Unit 4 and talking about capillary puncture.